You might have seen videos or pictures of athletes working out with something attached to their arms or legs, and you might be asking yourself, what is that? That is a tourniquet. That is how a groundbreaking technique in rehabilitation called blood flow restriction, BFR for short, is applied. BFR represents a paradigm shift in physical medicine rehabilitation. This method involves limiting the blood flow to an exercising limb using a tourniquet, with the goal of providing adequate training stimulus needed for adaptive physiologic response while exercising at a significantly lower intensity than traditional strength training methods. In BFR, we use subocclusive pressures during exercises. According to research, the optimal pressure for the lower extremity when using BFR is 80% LOP and 50% for the upper extremity. LOP, which stands for limb occlusion pressure, is the amount of pressure needed to fully restrict blood flow to a limb, that is, 100% occlusion. How is BFR able to take the place of high intensity exercise? The answer lies in physiology. Muscle adaptation requires consistent stress and fuel. BFR mimics the hypoxic environment of a high intensity exercise by limiting the blood flow to the exercising limb. By switching to anaerobic metabolism, we are increasing metabolic byproducts, which has a powerful role in muscle physiology as much as mechanical loading. Why is there a need to exercise at a lower intensity? For starters, people suffering from an acute injury, an illness, or recent surgery cannot exercise at a high intensity. These same individuals are also at risk of losing strength, endurance, and muscle mass, aka muscle atrophy. Essentially, anyone who can benefit from exercise but unable to work with high intensity can benefit from BFR. Traditional strength training methods are performed according to the gold standard set by the ACSM, that's the American College of Sports Medicine, which recommends that individuals perform resistance training at a load greater than 65% of one repetition maximum in order to achieve strength and hypertrophy adaptations. Individuals receiving physical therapy would rarely tolerate exercising with this amount of load. That is, if they're even allowed. Think of your precautions and contraindications. Meanwhile, their muscle mass, their strength, and endurance are expected to decrease during this period. This period is when BFR can help the most. So, how is blood flow restriction training actually performed? In my practice, I use a Delfi BFR unit. This is a third generation tourniquet system that offers a standardized, personalized, and intuitive application of BFR. In another video, I discuss why these attributes are all very important for proper BFR application. So I start by applying a limb protection sleeve at the proximal portion of the arm or leg where I will be placing the tourniquet. Note that the tourniquet is always placed proximally. I then place the cuff along the proximal portion of the limb over the sleeve and secure it there by tightening the Velcro. Once the sleeve and the cuff are in place, I make sure that the cuff is connected securely to the BFR unit using the supplied pneumatic hose. Once everything is in place, I turn the machine on. The machine will self-calibrate to establish correct pressure readings. Your exercise goal will determine what protocol to use. The Delfi unit contains pre-programmed protocols for upper and lower extremities. The main BFR protocols are strength protocol, endurance protocol, and ischemic conditioning protocol. To start, I will measure the subject's personalized tourniquet pressure, PTP for short, and I do it by touching the screen where it says PTP on the lower left corner. The machine will give out an audible once it determines your LOP, that's your limb occlusion pressure, that's 100% occlusion. The machine will automatically calculate your personalized tourniquet pressure based on your LOP. Note that your LOP can be different between your right and your left, and even from day to day, hence the importance of being able to measure your LOP. Once you hear the sound and your subject is ready to exercise, touch the green check mark to acknowledge your personalized tourniquet pressure. Now you can press the inflate button on the lower right hand corner of the screen to start the exercise. This unit will give you audio-visual feedback throughout the workout. The built-in microprocessor within the unit will try to maintain your PTP while you're doing your exercises. You can see through the screen how the pressure will change throughout the exercise and how the unit tries to maintain your pressure at the therapeutic range. A typical bout of exercise for strength protocol is composed of 4 sets of 30, 15, 15, 15 reps with 30-second rest in between sets, wherein the cuff stays inflated. I typically do 2 to 3 bouts of exercises per session with a full minute of rest wherein the cuff is deflated in between exercise bouts. For example, if my goal is to increase strength and hypertrophy for the lower extremity, I will be using 80% LOP. For my first bout of exercise, I will perform half squats of 30, 15, 15, 15 reps with 30-second rest in between sets, with cuff inflated throughout. When finished with your 4 sets, you just touch the deflate button on the screen to start a rapid deflation. I will have a full minute of rest before I start my next bout of exercise with the cuff deflated. For my second bout of exercise, I will perform long arc quads with the same 30, 15, 15, 15 reps with 30-second rest in between sets. Cuff inflated the whole time, followed by a full minute of rest with cuff deflated before my third bout of exercise. My last bout of exercises can be straight leg raises, performing the same 30, 15, 15, 15 sets with 30-second rest in between with cuff inflated. You can use any combination of exercise bouts and in any order. In the same for the upper extremity, except we will be using 50% LOP. Remember, you are still performing exercises with the goal of increasing strength and hypertrophy, so you can use any of your go-to exercises with BFR. Hundreds of peer-reviewed research articles support the use of BFR to increase strength, increase muscle mass, and increase endurance. For more information, I go to owensrecoveryscience.com. This is where I find any relevant information regarding the use of BFR for my clinical practice. There, you can also find BFR certified clinicians near you. If you want to see more videos and information about BFR training, please leave a comment and check out my other videos. And if you like any of the videos, please click the like and subscribe buttons. Thank you.